Putting the lens on Grenada, its people and its possibilities. This is State of Affairs, Season 2. Reporting this week, I am Tahira Natalie Carter. In this week's show, Chick V in Grenada, the labor force affected, even the country's health sector is targeted as a nation fights back. Grenadians preparing to go to the polls, not to elect a government, but to vote for changes to the constitution. We report on the debate months away from a historic referendum. And search and rescue, new and important tools used in disaster management, on display at the height of the hurricane season. Find out how they can make a difference. Kevil Frederick, Trevor Thwaites, and myself all report from the Grenada heartland when we come back. National television now responds to the need for investigative packages that probe deeper.
State of Affairs tells you how cocoa is doing in Grenada, an industry that is fastly growing, booming to leaps and bounds.
State of Affairs goes beyond the headlines to explain the story, the issues that affect our lives.
The idea is to promote the consumption of our local produce.
Probing, informative, educating, and even entertaining. Last season, you told us we raised the bar for broadcast journalism. Don't miss State of Affairs Season 2 on national television. Welcome back. Since the start of the new year, health officials have been on a major offensive with measures aimed at combating the spread of the chikungunya virus in Grenada. Measures have focused on our ports of entry, a fogging program to stamp out the Aedes aegypti mosquitoes, as well as an aggressive information campaign to educate the population. Despite their best efforts, however, the virus has managed to make some inroads in Grenada, taking a toll on the labor force and threatening the core of the health sector.
Chikungunya is now epidemic in Grenada, and the country's top government and non-government health officials are reporting widespread suspected outbreaks of the virus in almost every parish, including the sister isles of Carriacou and Petite Martinique. The disease has also impacted the local workforce, forcing government and private sector officials to institute various measures to keep their doors opened. In this State of Affairs special report, we sat with Director of Primary Healthcare, Dr. Francis Martin, who explained that as Grenada and the Caribbean braces itself for the full onslaught of the virus, the after effects are most worrying.
The backside of Chick V virus infection is what worries me most, and that is 47% of the people who have Chick V now are going to have relapse of the symptoms of joint pains and deformity of the joints, and that relapse can last anywhere from 10 months up to 3 years. That population of persons will have difficulty with production and productivity. That population of persons will have difficulty making a living. And that can have very significant effect on a person's household and the country as a whole.
Already, the virus has hit home as dozens of healthcare providers are affected, so much so that the emergency response systems were put into effect at the General Hospital. Acting Director of Nursing, Hazelyn Benjamin.
Chick V virus has taken a toll on the nursing fraternity and as it relates to hospital services. Currently around 40 nurses on sick leave in General Hospital. We may have about 12 or more in Princess Alice Hospital and about 4 in the Princess Royal Hospital to date. In relation to how we are coping, well, we have seek permission from Ministry of Health so that we can activate the emergency rota so that we can deal with the shortages of staff. So right now on selected wards, we are doing the 7 to 7 shift so that we can meet the patient care demands and still help with the staff, the limited staff that we have, so we do not have severe burnt out.
Not only nurses are affected, but a number of physicians has fallen victim to the debilitating effects of the virus.
Our whole health system itself is experiencing a little shock in the sense that even healthcare providers are coming down with this illness, and that's not unusual for infectious diseases like these. I mean, we heard stories of the Ebola where healthcare providers are also being having the problem. St. George's Health Center, for example, a number of nurses and the physician there is now sick and have to be home. In the hospitals and the ER, my colleagues are there working as best they can, but many of them are actually sick and can't attend to the numbers of persons.
Scary, isn't it? It was against that background the Ministry of Health in January of this year began sensitizing citizens about the disease and its effects. A 2-day national cleanup was conducted as a means of reducing mosquito breeding. Andre Worm is the Chief Environmental Health Officer, and despite the ongoing fogging operations, he said individuals must place more emphasis on source reduction.
We have to reduce the breeding sites of the mosquitoes. We're talking about primarily the #1 container in terms of breeding, which we're talking about the 45-gallon drums. And we would want persons to cover those drums as best as possible, because those are what we call essential containers, containers that you would want to keep around your home. The non-essential containers, that is containers that you would want to discard from around your home, we're asking you to clean up. Do that, clean up all the bottles, clean up anything that would hold water as much as possible. And that may include even some plants.
Notwithstanding the fact that fogging is very expensive and it only kills the adult mosquito, Worm told State of Affairs that there are more sustained benefits to be gained from cleaning rather than fogging.
Of course, there is a cost benefit to source reduction over fogging operations, because generally insecticides are not cheap. Insecticides are very expensive. Apart from that, there are usually physiological impacts of insecticide on the human body.
So how are some people dealing with chickpea? Margaret Goddard was a victim of the virus.
It was a very difficult experience for me because first my daughter, she's 16 years old, and one morning she just got up and told me she could not move. And I was a bit concerned, so I went across. I wanted to realize that she had the swelling of her joints, she had fever, very high fever, and a lot of excruciating pains. So as a member of staff of the Ministry of Health within the epidemiology department, I was privy to certain information as to what sort of medications and should be given, so that I was able to administer some of those medications to her, and it helped. But for myself, it was a different situation, because as much as you knew what you were supposed to take, because it came on me so suddenly, I'm a bit shocked, I couldn't get up, my feet were swollen. Actually, I had to get help to get off my own bed.
Managing outbreaks like these also calls for readiness at our ports of entry. As a matter of fact, no effort is spared in managing such crises, and every preventative measure is taken. A healthcare provider on duty at the Maurice Bishop International Airport spoke about the measures in place.
This is our new quarantine area for persons coming from any outside countries, international countries, especially from the African region, who are infected with Ebola, or persons coming from the region who has the chikungunya virus. We have our oxygen, we have our bedding area, we have our mask, and the nurses, we have our mask, glove, and gown, in preparation for persons who has chickpea or the Ebola virus.
The severity of the outbreak and its consequences has prompted the Ministry of Health to activate a national hotline, 403-7656. Chief Medical Officer Dr. George Mitchell tells us why.
Hello, Chikungunya Hotline. How may I help you? Right. Is it related to chikungunya?
We think that with the current state of chick-V in the country, that it is important that we are able to connect with persons or allow persons to connect with the ministry to allay their fears or to address all concerns that they may have in relation to the current epidemic. We have all our health facilities open as per usual, but we think that persons may wish to ask questions, may wish when our facilities are closed in general terms after 4, may need to ask questions or may have concerns, and we think that it is extremely important that we at the ministry are able to answer those questions in an efficient, prompt manner to allay, as I said before, their fears and concerns.
State of Affairs learned that several mosquito nets were also obtained by the Ministry of Health to help manage the disease.
The nets have arrived, and we have devised a plan and a method of distributing these nets to the different facilities. The hospital facility, the health centers around the island, we have divided them between the health facilities so that in the event that we have use for them, they will be closer to where the illness, supposedly will develop and be able to do that. But we do have quite a bit of nets.
Meanwhile, although persons are being told to consult their physician, visit the nearest health facility, use paracetamol or Panadol to ease with joint pains and anti-itching medicines to deal with the rash as prescribed, experts say chick-V could be around for a very long time if we don't improve on our garbage disposal habits.
Chick-V doesn't have to stay, but we can keep chick-V here if we continue to keep our surroundings unclean.
For this week's State of Affairs, I am Kevin Frederick reporting.
These are the images from across Grenada. This is State of Affairs. More stories from the heartland after this.
National television now responds to the need for investigative packages that probe deeper.
State of Affairs tells you how cocoa is doing in Grenada, an industry that is fastly growing, booming to leaps and bounds.
State of Affairs goes beyond the headlines to explain the story, the issues that affect our lives.
The idea is to promote the consumption of our local produce.
Probing, informative, educating, and even entertaining. Last season you told us we raised the bar for broadcast journalism. Don't miss State of Affairs Season 2 on national television.